the immediate project and the summit project are very complementary. Finally, we have the same objective. We focus on the beta cell, to summarize. You focus on the V cells, if I can summarize that. And this is very interesting, and it would be interesting to have maybe interactions between both projects, because really the target and the objectives are very similar. We have the same a very similar objective.
I can only agree to that, Alain. That's very clear. I think we will have a first meeting or towards the end of the year when we talk about also data, the first data, and I think then we should have clearly also a path forward how we can interact, what is the basis for the interaction then, and also exchange of data. Then, of course, ASE Media also Summit will publish more or less all the data which we gather.
Very good idea. I agree.
I think Leif wants to add on that.
Yeah, I think it could be quite, useful synergy, and a lot of, the phenotypes existing on these large cohorts clearly also would include, measurements of beta cell function and phenotypes relevant for media. So I think that we could have a fruitful collaboration.
Actually, I have a question related to that, because I see that the person that worked on the project agreement is here as well. Do you see any objections to that in what you, having dealt with the IP agreement before the media, if I remember well?
In general, as part of the project agreement, you have a non-confidential agreement, and or a confidentiality agreement. And clearly, before you engage in any kind of discussions like that, you have to be very clear and very transparent to all your consortium partners what you're going to discuss and how you're going to discuss it. Because, the project themselves are all confidential, if you will. So that's only we have to keep in mind. I don't think it's a problem. I only think we have to do it appropriately.
But you think that the willingness would be there from what you've seen so far?
I think the what I can only stress what Ellen has said is I see synergies and I also see complementarities, because clearly, for instance, the cohorts you are collecting and so on would be ideal for biomarkers, validation and so on, which going to happen in the media. So to some extent, you can see there this win-win situation, but clearly you have to talk to your consortium members and make sure that they communicate appropriately. But that's, I don't think it's an issue. It's only something you ask me about what's in the project agreement. That's what's in the project agreement.
Yeah. And I know that it required some reflection to actually get to these project agreements. So even with the lawyers from the companies and technology transfer offices and the universities. Okay, are there any other questions? Yes?
Thank you. My name is Thomas Friedrich. I'm science editor for the German newspaper Die Welt. I want to address to you a question about the intellectual property right, which was in the beginning of the IME initiative quite a crucial problem, and I still noticed today from the EFRIA Director General that it still is an ongoing discussion between the academia world and the companies. Can you elaborate on this? What is the state of art? And you expressed the new spirit of working together and a lot of optimistic, but from associations, for example, in Germany, I hear quite still a lot of question marks. Thank you.
Well, maybe there will be a special session on IP tomorrow, where you actually could get your question as well, get an answer and more specifics. I don't know personally. I don't know the details, but tomorrow there will be a session as well. Yeah.
I think you are right. At the beginning, there were open questions on the IP rights, where they lay, and how can we access then these IP rights if they come from academia partners, if they come from any partner on that. So we had discussions on the project agreement, and I think at the moment, every partner has signed the project agreement. Everybody is happy, so we find, and this is a signal to you also back, we found a compromise, and I think this is a very fair compromise based on the IMI rules which were set, so the frame was set, but within each consortia you could have some flex terms in it, especially in the IP section, and I think we clarified that. It was a little bit difficult to understand, but if you make a clear example, I think that helps in order to have for all the partners very transparently laid out what are the potential problems and what are the potential benefits. So I see Peter Hecht nodding in his call. It was more or less the same than with that. So for me, that is solved by the date where we have signed the project agreement.
And actually, I can add something from a different area. There is that in the open source development movement, there is also IP. But IP to protect the openness of the project and to protect the integrity of the code. So naturally, people needed to some time to get used to the new ideas and understand the new ideas. And that's why there were discussions around it. I think right now, everybody seems to be, quite a few people seem to be comfortable with it. Yeah. But it's not because you're in an open innovation that you don't have protection of the rights of the project. Even in open source, it's protection of the freedom of the code. These days. Okay. Anything else? I actually, in terms of the in-kind contributions, can you give some examples of those on specifically what they are, and that would be interesting actually. You have a little bit of time.
Yeah, the in-kind contribution really reflect more or less all of the work packages. With the exclusion, I would say the work package 5, where not too much efforts are done currently or are as advanced as in academia with in silico on data mining. But all the other work packages are also with the contributions of the FPR partners. That means the in-kind contribution comes either running a new clinical trial, we have such an example, developing new animal models, another example, or granting access, for example, you know, all Hoffmann-La Roche, and they have a good diagnosis section. They provide access to their diagnosis markers, and we have, as a consortium, then access to their expertise in developing biomarker assays. Another example is for the lipidomics, metabolomics, where another partner contributes actively, not contributing in cash, but doing active work which helps the consortium. And they use various platforms which they use either in-house or have subcontracted to already existing partnerships. So it's really a very broad spectrum of the in-kind contribution, and also is telling that some of the partners do contribute their in-kind to more than one work package only.